Welcome to Social Work Talks. My name is Greg Wright, and on this episode, we're going to have a conversation about social work and fatherhood and how social workers can support fathers. Our guest today is Dr. Charles Daniels, co-founder and CEO of Fathers UpLift in Massachusetts. Welcome to Social Work Talks, Dr. Daniels. How are you?
Doing well. Thank you for having me. Looking forward to the conversation.
Yep, absolutely. So, how did you get interested in fatherhood and the role of social workers in helping fathers in the first place?
Well, I grew up without my father, so I experienced a lot of the issues that children that do not have fathers in the household experience, from substance use to challenges with mental health and substance use. That was me. So, when I got to school, Simmons School of Social Work, I had an opportunity to do a fellowship. And then when I did my fellowship, I met these group of dads who were absent from their kids' lives. And they taught me all about what it is that fathers feel who are absent from their kids' lives. So what I thought I knew about fathers, I didn't know what was going on. And what I thought I knew was that fathers didn't love their kids when they were absent. But what these dads taught me is that fathers love their children despite being absent. And there are challenges that prevent them from being in their kids' lives. So that's the origin of why I'm doing the work. Yeah.
Yeah. So, could you tell me a bit more about the group that you met with? Like, were these like social work professors? Were they your friends? Who are these fathers that you met?
Yeah, so I had a fellowship, $3,000 fellowship to do a community project, and I chose fathers. So these dads were dads at a sober home at the Demi Community Health Center, and all of them were absent currently because of substance use and poverty. But also there was a lot of shame there. They didn't know how to pick up the phone after not seeing their kids for a couple of years, right? So that's a challenge that, pick up the phone is a huge challenge, right? But, when you think about how light a phone is, you don't think how hard it is to actually pick it up. If you haven't seen your kids in a long time, it's extremely difficult. So those are the dads that taught me all about fatherhood.
Yeah. So, like in our society, motherhood is played up more. Mother's Day is, I think, a bigger holiday than Father's Day is. Look, I'm a father. On Mother's Day, take them out to eat, gifts. I might get a pair of socks if I'm lucky. So does our society kind of downplay the role of fathers, and also how important are fathers in a child's development?
Absolutely. I would say, yes, society has downplayed the role of fathers, especially fathers of color. I think when we look at the history of slavery, we also look at the history of parents being separated from their kids. I mean, there's a lot of trauma there, right? So when you think about the media and the role that it plays and fathers being absent from their kids' lives, there's a huge role. I can say that society is becoming a little bit more compassionate over the years, more compassionate than they ever were. I do see progress in that regard. Nonetheless, we still have a lot of work to do when you look at child support policies. We still have a lot of work to do when you look at the child welfare department and how they mistreat black and brown fathers at alarming rates. When it comes to why fathers are important, we see it in the research. Fathers contribute to the positive educational outcomes of their children. We also see that when the father's involved, the child is less likely to have behavioral issues, engage in substance use, mental health related issues. A father's presence is transformative, not just for the child, but it's generationally transformative, and that's what we see in the research.
Yeah. So, if we look at our child welfare system, and how it treats men and also men who are black or brown, what are the inequities that you have seen there?
Oh my God, it's so much. It's so much. I think the child welfare system is deeply embedded in that traditional masculine way of looking and viewing fathers. And there's already this perception of what a man should be doing. Just like with child support, there's already a perception of what a man should be doing. He should be paying his child support bill, or he should have this house. He should be doing this, and that to have access to his children in the child welfare department. But those unrealistic expectations are not reachable for a lot of fathers who lack adequate resources, opportunities, and things of that nature. So it seems like you're being set up to fail when you don't necessarily have those opportunities or even know how to navigate challenges associated with fatherhood. So yes, I think they're still in that archaic way of viewing men, which really challenges them with being able to be in their kids' lives.
Yeah, so in other words, the system is like focused more on a materialistic end of fatherhood and like not the emotional support that a father may provide.
Absolutely. And I think that's overall one issue that we're seeing in society as it relates to fathers. You know, emotion is secondary to what it is you can provide and do for another person. And fathers learn that when they become fathers for the first time. Some common things that you hear from family members, from relatives, hey, you need to take care of the child and the parent that's bearing the child. Right? Everything else is secondary. Work, get that money, and make sure your children are taken care of. But what about you? You don't really get
Mhm.
much information about what you need to do for yourself. So
Yeah, so you have an organization that's called Fathers Uplift. I want you to talk to us about what was the idea for creating that and how many folks are you serving now?
yeah, I did. You know, came from me and my wife, who is the co-founder and a clinical social worker herself. Her father's uplift. She had her father. Her father made her feel as if she was a princess while she was in Haiti, and her father was in Florida, and she was inspired by the fact that fathers could be engaged in their kids' lives, even though they're thousands of miles away. So she takes their experience of having a positive father in her life, and she brings it to her work. On the flip side, I didn't have my dad really navigate a lot of those challenges that children experience where they don't have their fathers. A good portion of children experience that do not have their fathers. So we came together to really figure out how can we support dads that are struggling to be the fathers they've always dreamed of being. We both say that no father dreams of being a deadbeat when he's a kid, and that's true. I'm gonna wake. I'm gonna grow up and be a deadbeat to my children, not be present. No father listens to their child for the first time and thinks that. So
Yeah, so what kind of like services are offered there? And is your like staff all like social workers or are there like other professions mixed in? What is your team looking like in other words?
yeah. So annually, we serve over 1,000 men and families, direct services. That doesn't include what we do externally through other avenues, training social workers on how to engage fathers. That number has amplified dramatically. Since our existence, we served over 12,000 men and families through various functions. In terms of the breakdown of our group of people that work for us, they're social workers, but they're also peer-to-peer, they're peer service workers as well. So we have a lot of fathers that graduate our program and they end up becoming a team member, supporting fathers that are experiencing similar challenges as they experienced. So,
Yeah, so
I'm sorry.
oh no, I'm sorry. Are your services only in the Massachusetts area or are you also extending those like trainings out nationally?
Absolutely. So currently, you know, the clinic directly, we're providing therapy to fathers, men and families in Massachusetts, but we do have a national drop-in group of fathers nationally, where it occurs every Tuesday at 4 o'clock via Zoom, and fathers everywhere could come and join in and get support that they need. We also have a national fund for fathers, supporting them with any issues that they may have related to child welfare, court fees, and fathers, regardless of their location, could take advantage of that fund. So we have different services that are geared towards fathers locally and nationally. And kicking off in the fall, we have a therapist recruitment fellowship that we're starting that will be available to students nationally who are in graduate school, preparing them to be future therapists in the field, serving men and families. So we're doing that too.
Yeah, so I was wondering if you could give me a scenario of your like typical client. Like I mean, and I know that, you know, everyone's like different. Everyone has a different story, a different background. But um like tell me about a case of a person, a father who walked in, um what were the issues that that person like faced and how did your organization help them?
Yeah. So I'll give you one dramatic issue, very dramatic, but also very painful for this father. So he adopted this child. He's an adopted father. Adopted this child. He was his child. Someone called and made a false allegation against him that wasn't true. He ended up having to go to court. He ended up having to wear an ankle monitor. Also, he ended up on the verge of losing his job over these false allegations. He also lost his child, who ended up in foster care due to these allegations. So when we think about the challenge, that was the challenge. There's a false allegation against me. I lost a child that I love, who's mine, that I raised, and I want him back, right? So much of how we supported him was through advocacy, but also through therapy, right? Validating him, but also supporting him with navigating these challenges and getting the court to overturn the case, which eventually occurred. They overturned the case. They realized that these were false allegations, and now he's with his son again, who was taken away from him because of these false allegations. And you know who was involved? Child welfare and the legal system. So
Hmm.
support with navigating that was what we were able to do. And a lot of our constituents have child welfare involvement, and they have histories of incarceration and trauma. And most likely
Hmm.
they're black men. So that's the majority
Yeah.
of our population. Yeah.
Yeah, so I mean, if a father is incarcerated, does your organization help them maintain a tie in any way with their
Absolutely.
children?
Yeah, but here's the thing, maternal gatekeeping is real big in our community, right? If you have men going in and out of prison and jail, there's a lot of distrust, and the majority of work is geared towards getting the family to let down that guard so we can maintain those relationships. But that part takes a lot of time before we even get to the piece with fathers being engaged in their kids' lives.
Hmm. Yeah, so if you look at the makeup of the social work profession, it's about 70% female. And I was wondering, how can you advise a female like social worker to be more like sensitive to an issue that a father is like facing, because I mean we all have our biases, and a lot of times they're an unconscious bias, so you might like act toward a person in a way without even like thinking of it. I know that our association, we really do a lot of training on the issue of cultural competency, but like how can you like use that to help black and brown fathers though?
I think the core of that is to really start off with their relationship with their father and the man in their life, because typically the nature of their relationship will play off in their work in the field. So that's where we start. We really unwrap, and they have to grapple with that, right? What is my expectation of men in my life, and also what is the trauma that I've experienced from men in my life, if present? And that's a piece that they have to spend a lot of time on before they actually do the real work.
Yeah, gotcha. Well, look, I want to thank you for like being our guest, and as a final question, as far as how our society treats like fathers, if you could have like a wish of how like things should be in like 15 years or 20 years even, where do you want us to like be then?
Yeah, I really want fathers to have the opportunity to define the type of father that they want to be, and for a lot of these systems to be okay with that definition of what the father they want to be. I think that's the hard part, getting the system to be okay with that and meeting them where they are. That's the hard piece. And I hope that there's no longer an issue in 15 to 20 years. Yeah,
Yeah, thank you.
thank
Thank
you.
you. This is Dr. Charles Daniels. He is the co-founder and CEO of Fathers Uplift in Massachusetts. Thank you for being our guest on Social Work Talks, Doctor.
Thank you. I appreciate it.